Welcome you all to breastfeeding training course. Today's module topic is early initiation of breastfeeding and skin to skin contact. I am Dr. Nalina, working as assistant professor in Department of Neonatology, St. John's Medical College Hospital, Bangalore. What are the learning objective of this module? To understand the concept of early initiation of breastfeeding and skin to skin contact, what are the advantages and how to initiate breastfeeding early and skin to skin contact. So, what is this early initiation of breastfeeding? This initiation of breastfeeding soon after the birth, irrespective of mode of delivery. WHO and UNICEF recommends either in vaginal delivery or in cesarean delivery, we should initiate breastfeeding within first hour of birth. And it is the step 4 of baby friendly hospital initiative. What is this skin to skin contact? Skin to skin contact is the practice where the newborn baby is dried after the birth and put on mother's bare chest to provide the skin to skin contact. And we should be giving skin to skin contact at least for 1 hour. And it is the step 4 of baby friendly hospital initiative. What is the current practice of breastfeeding and skin to skin contact? According to UNICEF 2016, only 45% of the newborn babies receiving breastfeeding within 1 hour of birth and experiencing the skin to skin contact. In India, the early breastfeeding rate is only 41.5%. But we should have a goal to achieve this breastfeeding initiation within 1 hour and providing the skin to skin contact for all stable babies to 100%. Why it is important to breastfeed within 1 hour of birth? After the birth, a normal unit will go through 9 stages of newborn behavior, and it is called as a Winstrom's 9 stages of newborn behavior. As you can stay in the picture, in the first 1 hour, baby will go through 9 newborn behavior stages, starting from stage 1, where immediately after the delivery, baby will cry. Then in the stage 2, baby will go to stage of relaxation where the babies will take rest. In the stage 3, this is after 3 to 5 minutes after the birth, baby will start moving the limbs. That is stage of awakening. And stage of activity, which is the stage 4, where baby will be moving upper limb, lower limbs, trunk movements will be there. And in the stage of 5, that is rest stage, baby will take again rest for 3 to 5 minutes. And in the stage 6, which is important stage where baby will crawl towards the mother breast. This is also called as a breast crawling stage. And in the stage 7, baby will be familiarizing with the surrounding, that is mother breast, nipple, areola. And in the stage 8, baby will be having active suckling movement. We should identify this crawling, familiarization, and sucking stage, and we should help the mother and neonate to initiate the breastfeeding during this stage. And this stage is around 20 to 60 minutes after the delivery. After this sucking stage, this is usually after 60 minutes after the birth, baby will go to a final stage, that is stage 9, is a sleeping stage, which lasts for around 1 to 2 hours. That is why you would have heard the mother or the nurses complaining that baby is not sucking on the mother's breast, baby is sleeping. So we should not miss the golden opportunity within 1 hour. So we should identify crawling, familiarization, and sucking stage, and we should help the baby and mother to initiate the breastfeeding during this 1 hour of the birth. What are the advantages of this early initiation of breastfeeding? It has lot of advantage to mother and neonates. In the neonates, baby will get the colostrum. As you all know, colostrum is also called as a liquid gold, which is rich in protein, immunoglobulins, antibacterial peptide, growth factors, which is maximum within the first 12 hours after the birth. If the baby gets the colostrum, the chances of neonates getting the infection is less. And those babies who have initiated the breastfeeding within 1 hour, it reduces the neonatal death by 22%. It establishes the exclusive breastfeeding. That means that those who have initiated the breastfeeding within 1 hour, that exclusive breastfeeding rate will be high in this group of babies. As the breastfeeding is establishes, reduces the rate of hypoglycemia, reduces hypothermia, improves the bonding between mother and baby. It also has advantages to the mother. When the baby initiate the breastfeeding or baby starts sucking, mother's posterior pituitary starts secreting oxytocin. This oxytocin help in contraction of the uterus, thus preventing the postpartum hemorrhage. It increases the prolactin secretion. As the baby suck on mother's breast, mother prolactin level will be increases. So prolactin is important for the milk production. So promoting the early milk production. It improves the mother's and neonatal bonding, reduces the mother's stress level. What are the advantages of giving skin to skin contact? As you all know, when the newborn is exposed to the cold environment after the delivery, there will be a heat loss. Neonate can lose heat of around zero point 0.1 degree Celsius per minute of core body temperature. But when you provide the skin to skin contact, heat loss will be reduced as they establish the temperature stability early compared to those who have not received the skin to skin contact. It also helps in early establishment of the normal heart rate and normal saturation. It reduces the neonatal stress, promote the breastfeeding, thus reduces the hypoglycemia. To the mother, like breastfeeding, it helps in the reduction of postpartum hemorrhage, helps in reducing the maternal stress level, and improves the mother and baby bonding. How to initiate the early breastfeeding and skin to skin contact? This is the video which is demonstrating the skin to skin contact and initiation of breastfeeding in vaginal delivery. First step is to explain the parents about the importance of giving skin to skin contact, and immediately after the baby is put on mother's breast, head is turned to one side. We'll observe whether baby is crying, breathing, having good tone. If the baby is breathing and crying, having good tone, we'll tell the obstetrician to delay the clamping of the. Meanwhile, we'll dry the baby, chain the wet linen, and we will put the cap to the baby. And we will wait for 1 minute for clamping for the cord. After the 1 minute, we will tell the obstetrician to clamp the cord and cut the cord. Once they clamp and cut the cord, we will take baby, put the baby on mother's chest for skin to skin contact. And during skin to skin contact, we will observe whether the baby is going to the crawling stage, familiarization stage, and sucking stage. And we will help the neonate to initiate the breastfeeding. And we will also monitor the baby during this period. After this 1 hour of skin to skin contact, we can give vitamin K and other routine activities we can do. So as you can show in this picture, immediately after the birth, we'll note the time of birth, put the baby on mother's abdomen, turn the baby's head to one side. We'll assess whether baby is breathing, crying, having good tone. If the baby is having good breathing or good cry, having good tone, we'll tell the obstetrician to delay the clamping of cord. Meanwhile, we'll dry the baby and chain the wet linen. We'll put the cap also. And after the 1 minute, we'll put the baby in between the mother's breast. wait for the baby to go for all this stage of newborn behavior. When the baby is crawl towards the breast, start the stage of familiarizing, we help the baby to initiate the breastfeeding. This is in case of vaginal delivery. In case of cesarean delivery, we need to put little more effort. We should go to the mother head end of the head end, and we should take the help of the anesthetic. Instead of putting the baby vertically to the skin to skin contact, we can put the baby horizontally and wait the baby to go for different stage of newborn behavior stages. Once the baby is start having sucking movements, we will help the baby to initiate the breastfeeding as shown in the picture 2. What are the things to be monitored while providing the skin to skin contact? One of the rare complications during the skin to skin contact is sudden infant death syndrome, that is usually occurs the covering of the baby's face with the mother's skin. So baby's nose and mouth, if it is get covered, there will be difficulty in the breathing. So we should ensure that head is turned to one side while doing the skin to skin contact, and we should be monitored the following parameters. The parameters are monitored are breathing, color, temperature, and activity. And it should be checked and documented within once in 15 minutes in this 1 hour. What are the conditions where the initiation of breastfeeding is delayed? If the neonate requires any amount of resuscitation, or neonates requiring respiratory support, NICU admission, or if the mother is sick and requires ICU admission, or the neonate is less than 34 weeks where the neonate is not able to suck on mother breast, in this case, direct breastfeeding will be delayed. So what we should be doing in these conditions? We should ensure that colostrum is expressed within 1 hour of the birth, and we should give this expressed colostrum either to the tube feeding or through the pallida feeding. What are the practices which can delay the initiation of breastfeeding and we should not be doing? We should not be giving any pacifier. We should not be doing initiation of bottle feeding. We should not give any pre-lacteal feeds like sugar water, honey, gripe water, because all these can replace the colostrum as a first feed and delay the initiation of breastfeeding. Other important thing is making the baby to wait for feeding. These are the practices we should not be doing in this first birth. To conclude my module, breastfeeding should be initiated within 1 hour of birth, and skin to skin contact should be given for all stable neonates for at least for 60 minutes. And our goal should be initiation of the breastfeeding within 1 hour and skin to skin contact to achieve 200 percentage. And we should be monitoring the baby during this skin to skin contact. Thank you.